am very, very sorry, but with the diagnosis, you do not have very long to live. This used to be the given statement whenever a patient was diagnosed as a diabetic before the discovery of insulin. I have especially taken an interest on the topic of diabetes and the discovery of insulin because I have been diagnosed with gestational diabetes myself. Today, I will be speaking to you about the discovery of insulin after giving a brief review of diabetes itself. Diabetes is the body's inability to produce insulin. Insulin is normally produced in the pancreas and is used to break down glucose or sugars in the body into energy. When sugar levels spike, it can result in detrimental results like blindness, loss of limbs, and even death. Michael Bliss, author of The Discovery of Insulin, provides the Greek definition of diabetes, which means to pass through or pipe-like. Type 1 diabetes is diagnosed in people aged 30 or younger and is always insulin dependent. Type 2 usually occurs later in life and sometimes needs insulin injections. Most patients are overweight, but usually a healthy diet and exercise can fix it without injections. Gestational diabetes occurs in pregnant women only. It usually disappears after the delivery of the baby. However, this increases the risk of diabetes 2 to happen in women later on in their life. Dr. Frederick Banting first had the thought that the pancreas produced digestive juices in 1920. He told John MacLeod, who was the leading study of diabetes, about his thought. MacLeod gave Banting funding in 1921 to experiment, as well as a medical assistant named Charles Best. He started the experiment with 10 dogs. First, he removed the pancreas of one dog, and the dog became a diabetic. He then gave the weakened dog an injection of juice extract from its own ground-up pancreas. The dog started to recover with consistent injections. He repeated consistent injections and did this with other dogs and used extracts from cows as well. MacLeod saw this success and gave more funding and named the extract insulin. Bertram Collip joined the group and was there to purify the insulin to make it suitable for human injection. They injected themselves first in the arm and suffered weaknesses and dizziness, but were all right in the end. Then they began to work on the dosage corrections. Leonard Thompson, who was a 14-year-old boy from Canada with diabetes, was near starving and very near death when he first received a dose of the insulin. He recovered after injections and he influenced others to take it, saving lots and lots of lives. NobelPrize.org states on their site that although insulin doesn't cure diabetes, it is one of the biggest discoveries in medicine of all time. Diabetes used to be a guaranteed death sentence for victims before the wonderful discovery of insulin. Still, today, it is a very serious condition if not treated properly. Without insulin, so many people would not be here. Think about the many figures in history and society in general that could have died without insulin and how the world would be different today without them.